in the healthcare financing in the spirit of universal healthcare coverage. This, they say, will address the teething problems like service delivery and availability of non-pharmaceuticals. We now want to cross over live to our reporter, Alan Ochanda, who's just joining us for more updates on this particular move that's set to be a game changer. Good morning, Alan Ochanda. What exactly will the Health Services Fund achieve in terms for residents in Kakamega County?
Well, Jesse, yes, as you've mentioned, this is actually one of a kind. One, of course, the trailblazer in the counties. Remember that health is a devolved role. So for Kakamega County to ensure they deliver these particular services, of course, the governor himself, they've actually come up with a special fund called the Kakamega County Health Services Fund. Quite a special fund here, which they have actually tipped to be a game changer in the delivery of health services to the residents of Kakamega, and also the delivery and supply of non-pharmaceuticals. Remember that this has actually been ring-fenced and anchored in the law by the County Assembly of Kakamega. It began some time back, where it all just began as an idea, but coming to fruition, and as you can see behind me, the stage is already set here. We are expecting the PS in charge of health and also the governor of Kakamega County to be making their way here in a few. But let's just speak to the CEC in charge of health in Kakamega County. Karibu sana, Bwana Waziri. Just tell the viewers your name and, of course, what this particular special fund really means to your docket and the residents of Kakamega County.
Okay, my names are Bernard Wesonga, the Minister of Health in Kakamega County. Today we are launching Kakamega County Health Services Fund. This fund will be collects all monies that will be paid in the facilities. This money will be retained at the facility level, and it will be used to buy or purchase many items, including drugs, including medical equipment for the labs, including non-pharmaceuticals, as opposed to the system that we have been having, where money paid at facilities is swiped to CRF. Then from CRF is when it comes to the facility. And this has been delaying services. So the good thing about this service is that the monies will be available to be spent at the facility level for services that have been delayed because of a lack of money.
Maybe, Bwana Waziri, of course, moving forward, you're talking about being a game changer and ensuring that the money is collected in the health facilities. Actually, maybe earmarked to ensure that you also develop the health facilities. Maybe in the past, how has it been? Maybe what's the difference moving forward comparatively to how it has been in the past?
In the past, as per the Public Finance Management Act of 2012, all monies collected at the facilities was being swiped back to Treasury, and then that's the time it is appropriated back to the facilities. And this has been taking time. As you have noticed earlier on, our governor has been on the forefront talking about delays in funds, and this has been affecting provision of health services to our people. Now, with this Kakamega County Health Services Fund, money retained at the facility will go into an account that can be accessed by the management of health facilities, basically to address issues, as I mentioned, of drugs, non-farms, laboratory, and any other services that people require.
Nice. Waziri, I understand you also work with other men to ensure that maybe this particular idea comes to fruition and ensure that service delivery is actually streamlined to the residents of Kakamega. Maybe also to just talk to your chief officer here, Bwana David Alila. Maybe, unlike education where only ECD and vocational training are just devolved, you can see that health is wholly devolved from level 1 to level 5 or 6. From which level to which level do we expect that the county will now be collecting those monies and maybe forming this particular special fund?
Basically, the levels that collect revenue from patients are level 4 and 5, for that matter. However, level 3, 2, and 1, besides receiving some grants from Danida and whatever, the county takes care of them. And therefore, the amount that is going to be collected by the other levels of facilities will be budgeted for all these level 2, level 1, and level 3, so that they are able to operate.
On Sunday, when the president was here, President William Ruto, he also talked about this. And of course, you are now becoming maybe the pilot county. Yes, he talked on Sunday, but this must have been a work in progress. You began maybe some years ago, some months ago. But he also talked about initially the monies could be channeled to other projects. So do we expect that moving forward, these monies will be rotating in Kakamega or be going to some other port, then rechanneled back to this particular special fund? And maybe for the level 1 and 2, will this fund now also cater for level 1 and 2 because you're actually collecting from level 4? Will it now cater for level 1, 2, and 3 hospitals?
Absolutely, yes. The level 1 and 2 and 3 will be catered for, and we've budgeted for it. This process started some time ago, and it goes stuck somewhere. But with the blessing of His Excellency the Governor, who among his agenda, the agenda number 1 is health. He actually supported us through the cabinet, and he made sure that these facilities, they are going to retain 100% of their collection. They collect monies come directly to the revenue fund, the Kakamega County Revenue Fund. It will not be swiped to the county revenue fund anymore. Then through budgeting, we are able to spend that money at source.
Nice. Maybe the last question to the final man here, maybe just tell us the name and your title here. We can see community health promoters. Initially, they were actually referred to as community health volunteers. What is their contribution in this particular fund to ensure that it is actually a success?
Yeah, I'm George Mkodo, Chief Officer Public Health, and community health promoters solely fall under my docket. And as you know, they are the level 1. Actually, community health promoters are the level 1. And they are going to make sure that in every household we enroll, like NHIF. These people should be enrolled in the NHIF so that we can get the capitation to boost the fund that we are launching today. So the main role of the community promoters will be making sure that at the level 1, they visit the households in the community units and make sure that they are enrolled, and also they take care of their health issues, especially these small things like hypertension and the rest. They can do it at that level. And as you heard when His Excellency was around, he talked of matching what we are going to be giving to community health promoters. We are going to give them 2,500 as from July, and the county, the national government agreed to match at the 2,500 also. We are also enrolling them as the community in the NHIF, so that when they go to the community, they are also well catered for. So I think with that, there'll be good motivation, and we are ready to go. Thank you.
Nice. Thanks so much. Well, the 2 chief officers and the Waziri in charge of health here, and of course one of the officers here, but we shall also be talking to him maybe in our Swahili bulletin. But Jesse Rogers, remember that in the past, in the recent month, we've seen the health sector really agitating for the maybe returning of the health function to the national government. But with such initiatives, maybe the counties, the devolved units are now proving that they have the capacity to just have it turned around and ensure that the devolved units are now not really grappling with the teething problems in as far as dealing and just having the health function being devolved, but now making strides. And so Kakamega County really prides itself here, according to the officers in charge of health here, as being the first county, the inaugural county, to launch such a crucial and robust fund to ensure they streamline the service delivery